There are many bioethical dilemmas in the AP News article, FDA approves another generic abortion pill, prompting outrage from conservatives. In early October 2025, the U.S. Food and Drug Administration approved a generic version of mifepristone, the key drug used in medical abortion, by the company Avita Solutions. Even though there is currently a generic version of the drug, the new approval was met with anger from anti-abortion groups who are accusing the FDA of not providing a full safety review. The FDA approved the drug based on regulatory standards and evidence of safety and efficacy. To quote, approval of generic drugs is typically a rote process at the FDA, with multiple copycat versions usually approved after the patent on the original drug expires. In most cases, generic drug makers only need to show that their drug matches the ingredients and formula used in the original medication, unquote. Supporters of abortion view the approval as a victory for evidence-based policy and women's reproductive rights. The bioethical dilemmas include access to care, safety, autonomy, equity, justice, and political interference in reproductive health care. To quote, access to mifepristone is restricted across large sections of the country because of state laws that ban abortion or impose separate restrictions on the drug's use, end quote. The bioethical principles of autonomy, beneficence, and justice are challenged in this dilemma. If access to a safe generic is blocked, individuals no longer can exercise their autonomy over pregnancy decisions. Restricting and delaying generic approval can disproportionately burden those that are marginalized and low income. Approving safe generics promotes beneficence by increasing access to medically appropriate care. If regulatory or political barriers disproportionately harm certain groups, justice is violated. If the generic availability is blocked, those with fewer resources will suffer greater harm. Restrictions on the pill are not supported by most major medical societies, including the American Medical Association. This event is important to my profession as reproductive health is within the scope of practice I may provide, and ensuring patients have safe, evidence-based options for their care is part of my clinical responsibility as a patient advocate. The political environment should not influence my ability to practice or prescribe, and restricting care comprises ethics and access for many patients. Provision 1, respect for human dignity and autonomy, is at risk of violation if the generic, low-cost form of the pill is denied, especially for those with limited resources, as is Provision 6, ethical work environment. If equitable access is denied due to political pressure, then the environment is ethically compromised. Provision 3, advocacy, is upheld if nurses advocate for patients' rights and access to evidence-based reproductive health services. Provision 7 emphasizes that nurses, through research and policy involvement, must advance ethical standards and promote the profession's integrity. Nurses should resist non-science-driven restrictions and promote health policy that supports evidence-based regulation. There are many implications for healthcare. If the generic pill is approved in all states, disparities in abortion access for low-income, rural, or marginalized groups would decrease. This conflict may determine if healthcare will be ruled by politics or science, and may set a precedent for how reproductive medicine is regulated under political pressure, either reinforcing science-based evidence or conforming to political demands.